Hi everybody, this is Kyle Sears from ZOLL Medical. Today's ZOLL X Series tips and tricks video is going to focus on CPR feedback on the ZOLL X Series and what to expect during a cardiac arrest call. Let's take a look. Alright, so in a situation where you have to run a cardiac arrest, first thing is to turn the X Series on. It's going to run through a series of self-checks. You're going to get a self-test pass message come up on the screen saying that everything's fine. And the monitor is looking for a rhythm basically through the pads. So the pads get placed in an anterior-posterior position. It picks up a rhythm on the screen. And then as soon as CPR compressions start to be performed, you'll see all of the feedback come up automatically. The top rhythm is taking into account all of the artifact that occurs from the provider that is doing CPR at the time. They're moving the chest around, they're causing all sorts of interference and artifact. The second rhythm on the screen is our see-through Cpr technology, which we'll talk about here in a couple minutes. The numbers across the bottom, our CPR dashboard, represent the depth in inches, so every time a compression is done, the rate at which those compressions are being performed, whether or not the provider is allowing the chest to fully recoil during the decompression phase, which is just as important as depth and rate, and then the diamond acts as the perfusion indicator, so the goal visually is to get feedback on whether or not that diamond is full throughout the entire time you're doing compressions. The numerical values, when they are within 2 to 2.4 inches for depth and 100 to 120 compressions per minute for rate, will be green. If the provider is going too deep or too shallow, too fast or too slow, those numbers are going to be yellow. Now you can configure your X Series in several different ways. For audio feedback, you can have a metronome set up. So there's different ways to set that up. There's also a 2-minute Cpr timer in the upper right corner of the purple bar that's going to track your 2-minute cycles. And then I want to take a step back and look at that second rhythm on the screen, the see-through Cpr, and you're going to see a change here in a second. What you guys will experience is the majority of the artifact will be filtered out, so you can look at the underlying rhythm of the patient to determine whether or not you think they're probably in a shockable rhythm. The goal here to be minimizing the amount of time you're off the chest after your 2-minute cycle is up, determining whether or not that patient's in a shockable rhythm. So if you look at this and say, yep, that patient's definitely in VFib from what I look at now, you continue to do compressions, you charge up the device, and then because we do not filter out 100% artifact, we always want to pause for a second, verify the VFib that we think we saw earlier, deliver the energy if appropriate, and then get right back on the chest as soon as we can, and the CPR feedback will pop up automatically. We can then determine if we converted successfully or if we need to go through another 2-minute cycle. At which point, if we establish an advanced airway, we can hit the Untitled CO2 button, which you always want to do first, allow the machine to beep at you, and then go in the left-hand pocket and plug in your Untitled disposable. At which point you're going to start to see the waveform on the screen. You see your millimeters of mercury and your respiratory rate in the purple section on the side, and that's going to verify whether or not you have properly intubated the patient. The fourth button down are the code markers, which you can see being highlighted right now. Those can track the different activities that occur during the call, and will also upload into your electronic patient care reporting system. The camera button that was just pressed, at any point you touch that button, will jump back 12 seconds and go forward 12 seconds and record a 24-second snapshot of all of the waveforms and data that are on the machine at the time. So that's a quick review of cardiac